Welcome everyone. Today we'll be discussing a topic on the drugs used in erectile dysfunction and how to approach if this question is asked in your UG level, in your second year MBBS examination or in your PG level examination. So I'm dividing this topic into 10 marks section with the definition, physiology, and the drugs used. Mainly, this topic comprises drugs used in erectile dysfunction is the PDE5 inhibitors, and uh, other drugs are also used. So let's start into our topic, and this topic is divided into mainly three headings. Like first one is define erectile dysfunction, which might carry around a 1 mark, and normal physiology of erectile dysfunction should be explained, which carry around 1 to 2 mark. And then the main chunk of this topic, that is the drugs used in this erectile dysfunction, which mainly carry around 5 to 7 marks. And in this 5 to 7 marks, the main contribution will be towards from the PDE5 inhibitors, which is carries around 90% of the mark. And other, you have to mention other therapies also used in erectile dysfunction, such as androgen, pipe therapy, and prostaglandin E1 analogs also. So let's start with the definition erectile dysfunction. And the definition of erectile dysfunction can be defined as it's an inability to attain and maintain an erect penis with sufficient rigidity to allow a sexual intercourse. And causes of erectile dysfunction can be varied. Main cause of the erectile dysfunction is the old age. Beyond the age of 65, erectile dysfunction can start. And any other disorders which causes any vascular disorder or any neurogenic disorder or any hormonal disorder, all can cause erectile dysfunction. And other causes such as pharmacogenic or psychogenic. Pharmacogenic means which any other drugs can also cause androgenic deficiency. Certain drugs can cause androgenic deficiency, and all those drugs can also cause erectile dysfunction. And other causes include psychogenic. For neurogenic and psychogenic, the normal PDE5 inhibitor therapy is not that much useful. We have to sort other drugs you should be used, which will be described lately. And for all other disorders such as vascular, hormonal, and pharmacogenic, therapies are available. Mainly for the vascular disorders, we can use PDE5 inhibitors. So the normal physiology, whenever there is a sexual arousal, it is the parasympathetic system is activated. The parasympathetic, non-adrenergic, non-cholinergic neurons will get stimulated, and these non-adrenergic, non-cholinergic neurons will stimulate the endothelial nitric oxide synthase enzyme. These neurons will stimulate this endothelial nitric oxide synthase enzyme, and this nitric oxide synthase enzyme will in turn stimulate the release of the nitric oxide. And this nitric oxide in the corpus cavernosa and related blood vessels causes a vasodilation and relaxation of the corpus cavernosa. And this relaxation of the corpus cavernosa, which causes the corpus cavernosa sinus, will be relaxed, and the sinus will be filled with the blood, and which causes enlargement and the rigidness of the penis. So basically, the first stimulus, that if the man is having a sexual arousal, the parasympathetic nervous system, that's a non-adrenergic, non-cholinergic parasympathetic nervous system, will get activated, which in turn stimulate the nitric oxide synthase. And this nitric oxide synthase will help in the synthesis of the nitric oxide. This nitric oxide causes the relaxation of the corpus cavernosa and the vasodilation of the blood vessels surrounding the corpus cavernosa, which brings more amount of the blood to fill the sinuses in the corpus cavernosa. And coming to the drugs, the first one is so I think that's enough for the introduction part. Definition and normal physiology will cover up the introduction part. And coming to the drugs, we have already seen four type of drugs are used: PDE5 inhibitors, androgen therapy, pipe therapy, and prostaglandin E1 analogs are used. So among these four drugs, PDE5 inhibitors are the most important and the most commonly used drugs for the erectile dysfunction. And the examples include the sildenafil, tadalafil, and vardenafil. These three drugs are most commonly used as a PDE5 inhibitors. The mechanism of action is explained here. Mechanism of action or the pharmacodynamic property of these drugs. This is a normal physiology is shown here. There's a non-adrenergic, non-cholinergic neural stimulation is occurring, and endothelium nitric oxide synthase is getting activated. Nitric oxide is synthesized, and this nitric oxide will in turn activate another enzyme called a soluble guanyl cyclase enzyme. This enzyme will help in converting the GTP to CGMP, which releasing or which this cyclic GMP in turn stimulates the protein kinase G. Protein kinase G. And this stimulation of the protein kinase G causes the relaxation of the corpus cavernosa by dephosphorylation of the myosin light chain kinase and causes relaxation of the corpus cavernosa. So basically, this CGMP is the main factor that causing the relaxation of the corpus cavernosa by stimulating the protein kinase G. So we need more amount of cyclic GMP inside the corpus cavernosa cells in order to relax the corpus cavernosa. So we cannot directly inject the CGMP. We can prevent the metabolism of CGMP. And this metabolism of CGMP is prevented by the PDE5 inhibitors. This CGMP is metabolized to or converted to 5-GMP, and this conversion can be inhibited by the PDE5 inhibitors and thereby accumulating the CGMP and causes stimulation of the PKG, that is the protein kinase G, which causes continuous relaxation of the corpus cavernosa and uh, blood will fill the sinuses of the corpus cavernosa. Now, after completing the mechanism of action or pharmacodynamic property of the PDE5 inhibitors, sorry, next is the pharmacokinetics. And pharmacokinetics include good oral bioavailability, wide distribution, and these are metabolized in the liver by the enzymes CYP3A4 and CYP2C9. Here, CYP3A4 is mainly described in the bold letters. So, this is the major metabolism is occurring by the CYP3A4, and these drugs are excreted mainly in the feces. So, they are having good oral bioavailability, absorption, distribution, sorry, metabolism and elimination is described here in the pharmacokinetic section. And metabolism, you should note that it is metabolized by CYP3A4. So you have to think about drug interaction. CYP3A4, if any drugs induces or inhibits CYP3A4, can alter the availability of the PDE5 inhibitor drugs, and these are excreted mainly in feces. So these are renal safe drugs. Coming to the side effects, the classical side effects are the headache, flushing, nasal congestion, dizziness, back pain. All these are the classical side effects of these PDE5 inhibitors. Headache, flushing, and nasal congestion. All are due to the vasodilation property of this drug. And sildenafil and vardenafil can cause PDE6 inhibition also, which is also seen in the retina, and due to the deposition of the PDE6 in the retina and PDE6 inhibition by the sildenafil and vardenafil can cause blue-green color vision deficiency, and can also cause a blurred vision. So these are the classical side effects, and for sildenafil and vardenafil, blue-green color deficiency can also occur due to the PDE6 inhibition. Now, coming to the drug interaction section of this PDE5 inhibitors, as I already mentioned, that CYP3A4 inducers can cause increased metabolism of PDE5 inhibitors such as sildenafil, vardenafil, and tadalafil can metabolized in a higher rate, and their bioavailability will be reduced. So, if you are taking phenytoin or rifampicin, you have to increase the dose of all those drugs. And the CYP3A4 inhibitors can cause accumulation of the such as ketoconazole and ritonavir can cause accumulation of the PDE5 inhibitors, which can increase the toxicity. Next drug interaction is a nitrate vasodilator and alpha blockers. If you are taking PDE5 inhibitors along with the nitrate vasodilator or any alpha blockers, which might cause additive hypertension or increased chance of hypertension or orthostatic hypertension can cause. So that should be also be a concern when treating with PDE5 inhibitors. You should check whether the patient is on nitrate vasodilator or any alpha blockers. Now, coming to the other drugs mentioned for the erectile dysfunction include the androgen, which can be administered as a parenteral administration of testosterone. And these are useful in androgen deficiency induced loss of libido. If the patient is having a low level of testosterone levels, and which might be the reason for the loss of libido, then we can administer the testosterone parenterally. And the next main therapy is the pipe therapy. Pipe therapy is a papaverine or phentolamine induced penile erection. That's the full form of pipe therapy. Papaverine or phentolamine induced penile erection. Papaverine should be given as 3 to 20 milligram, and phentolamine can be given as zero point 0.5 to 1 milligram. These are directly injected to the corpus cavernosa. And sorry for the spelling mistake, and these are directly injected to the corpus cavernosa. And the side effects mainly include the priapism, that's a painful erection, and penile fibrosis can also occur. And as you know, this is a skilled procedure, so the patient should have a basic skill in injecting the drug to the corpus cavernosa. It should not be injected into the nearby vein or any other artery. It should not be injured. So it's a skilled procedure, and the other side effects like priapism and penile fibrosis can also occur due to the pipe therapy. And these two side effects are not seen in another therapy called prostaglandin or E1 analog such as alprostadil. And this direct also a direct injection to the corpus cavernosa, and can cause less episodes of priapism and penile fibrosis. These are used in PDE5 resistant cases such as neurogenic and psychogenic erectile dysfunction. In both these conditions, uh, the PDE5 drugs might not work as in other cases. So, if there is any PDE5 resistant cases, prostaglandin E1 analogs can be used successfully. So that's all about the drugs used in erectile dysfunction. If it's asked for a 10 mark question, you have to write it as definition of erectile dysfunction and normal physiology, and then you have to reach the drugs. In the drug section, the main mark will be carried for the PDE5 inhibitors, where the mechanism of action should be described, pharmacokinetic side effects, and the drug interaction should also be mentioned. Other drug therapies should also be mentioned, which carries the minimal mark. So that's all about this topic. We'll see in another section. Thank you.